Why I'm really an oncologist is because of the patients, and they are, the reason I think we all oncologists are here, because you just see these courageous people fighting cancer, and just be there for them is just an unbelievable experience.
The one thing I think I really loved most about working with Dr. Romero, it was almost like having a girlfriend. The first time we met, she gave me her cell phone number, which is pretty uncommon for doctors to give their patients their cell phone numbers. And I think I'm a pretty strong person, and one night I didn't feel that great. It's a Friday night, it's about 7:30, and I was like, okay, do I call her? So I texted her. So I texted her and I was like, oh, I don't feel great. What do you think I should do? Boom, within 15 minutes, she picked up the phone and said, hey, Michelle, how can I help you? To me, that's customer service at its best.
I had a patient a couple of weeks ago. This patient had Hodgkin's lymphoma 2 years ago, and I diagnosed her. She was, stage 4, and I gave her treatment with chemotherapy for about 6 months. We did the scans, and she did very, very well. So I followed her every 3 to 4 months. So I saw her last week, and she told me, well, Dr. Romero, I just turned 64. And I'm like, well, that's great. And I have to give you the good news that your latest scans are, free of disease and everything is good. So she told me, for me, 64 was such a milestone. And because my favorite song is When I'm 64 of the Beatles. And of course, I had no idea about that song. I felt embarrassed, but she sang a little part of it. And she told me since I was young and I was a fan of the Beatles, I wanted to, for my 64th birthday, just have a big cake with 64 candles. And I didn't want them to sing happy birthday to me. I wanted to sing, when I'm 64. And, those moments, that's what you live for as an oncologist. And I feel at that time that, just being there and being part of that moment for my patient was great.